Hi, I'm Andrea Mounce-Halasz, osteopathic manual practitioner, certified fitness instructor, personal trainer, and exercise therapist. And I'm here today to tell you a little bit about the vagus nerve and briefly talk about the autonomic nervous system. So I'm going to give you some tricks and tips and techniques. So that's the same with any exercises. You want to be absolutely sure that they're safe for you. So you might want to check with your physician. Also, if anything feels discomfort or pain, you can modify it or leave it out, all right? We've got lots of things that you can try if one doesn't work for you. So, what's the autonomic nervous system? There's two main systems. You have the sympathetic nervous system and you have the parasympathetic nervous system. So your sympathetic nervous system is commonly referred to as your fight or flight, your ability to get tasks done, to be able to do things very quickly and efficiently and respond quickly. And that's a good thing, but you also need to have that balanced with the parasympathetic nervous system, commonly referred to as your rest and digest system. And if we don't have a balance between the two, if we're always in sympa, that's troublesome. That's going to be challenging for your health. So we need a balance between the two. Yes, it's okay to spend time in sympathy. You need that, but you also need time that you're in para. So, what is the parasympathetic nervous system, which is what I'm going to focus on today? That is referred to, or that is made up of the vagus nerve. And the vagus nerve is cranial nerve number 10. And here it is. Its vagus comes from the Latin word wanderer, being a vagabond. It travels through the body. It exits the cranium, goes down through the esophagus, the throat, down the chest, innervates many different organs, your heart, your lungs, your liver, your spleen, your small intestine, and ends up in your intestines, your small intestine and your large intestine. So it's a very important nerve, yes. And you can imagine if we have issues in their tissues in any of these areas, that's going to affect the vagus nerve. Yeah, can you imagine? All your abdominal surgeries or any surgeries that you've had to your chest, all that scar tissue is going to affect the vagus nerve. So we'll do a little bit about that. So what does the vagus nerve do? It does a lot. Yes, it affects your mood. It affects your speech. It affects your saliva, your ability to produce saliva. It affects your swallowing. It affects your heart rate and your blood pressure, your breathing. It affects your digestion, very important, yes. It affects your urine output. It affects your skin and your muscle sensations. Yes, did I get them all? Taste, yeah, taste as well. So there you go. It's a very important nerve, and it's a very busy nerve, so we want to keep it definitely in a normal state. Yes. Okay, so in the vagus nerve, you have high vagal tone and low vagal tone. Now, how do you know who are you? Are you more high vagal tone person or more of a low vagal tone person? So the high vagal tone persons are the persons that if something happens to them that's upsetting, whether you got cut off on the highway or someone took your parking spot or even something quite tragic happens, they can respond but not stay in a reaction, not stay in that reaction for days, for hours, for days, for weeks, for months, and even years. They're able to self-soothe themselves out of that heightened state. Yes, they respond. Yes, they have the heightened state, but they can drop down into parasympathetic system quite easily. If you're one of those people, yay, good for you. You are high vagal tone. Congratulations. Now, if you're like a lot of us, including me, we are low vagal tone, and I'm working on this. I've been working on this for many, many years, and I'm going to continue to work on this, especially with these exercises that I've been researching. So low vagal tone people are people that are wired and tired, wired but tired. So you're like buzzed, but you're exhausted. You're the ones that try to fall asleep and you can't because your mind's going like crazy. Or you get to sleep and you keep waking up. Those are low vagal tone people. They're the ones that when they have someone cut them off at the highway or take your parking spot or something very tragic, they not only respond, but they react and they stay in that reaction for multiple hours, multiple days, weeks, months, and even years, and even to the point of having flashbacks. So this is when those low vagal tone people need to do these exercises for sure, because you know that you're one of those people, because you're not comfortable, you're not a calm person. You're always being challenged with that, with the anxiety, with panic attacks, with any multiple of reaction. So now, one of the ways, it's a very crude way, but you can probably tell by the way that you react to events. Do they stay with you, or are you able to self-soothe? So again, if you're able to self-soothe in your high vagal tone, and you might not need any of this, but if you're like most of us, you have a reaction to these events that happen to you, but unfortunately you stay in those reactions and you mull them over and you question them and you overthink them and whatever. That's one way to tell if you're in sympa or para, because if you're able to be high vagally toned, you're mostly in parasympathetic system, and congratulations. Now, there's another little method, but it doesn't work for everybody, but you can try it. So you're going to put your finger under your nose, and you're going to blow out through your nose 3 times, and you're going to notice which nostril the air predominantly comes out of. Now, you might get once out of one nostril and 2 out of the other. Well, that means the other one is more prevalent. Or if you get all 3 coming out of one nostril, then you know. All right, so here we go. Deep breath in and exhale through your nose 3 times, noticing what nostril, the right or the left, does the air come out. Now, I've been practicing this. This is interesting because before I did this video, I did this test, and it was so predominantly right side, which means I'm more in sympathetic nervous system. And now when I just did that, I was much more balanced because I've been practicing these techniques before I did the video. So guess what? They work. Anyway, so if you predominantly had most of the air come out of your right nostril, you're predominantly in sympathetic nervous system or low vagal tone. If the air predominantly came out of the left nostril, you're in parasympathetic. You're high vagal tone. You're calm. You've got your vagus nerve normalized, like I just proved, because I said I've been practicing these before I did the video, and then I just did that, and it was more equal. Still a little bit came out, and it's not necessarily all one side versus the other. When it's equal, you're probably high vagal toned as well. All right, let's get at it. Let's get to it. So the first one we're going to do is a simple one that you're going to massage your ears. So you take your hand and you just spread the fingers. Now, if you can't do the Vulcan move, you can do this, or you can do thumb and fingers. It doesn't really matter. So you're going to separate your fingers on each side of your ear. As I said, the vagus nerve exits the cranium right here in the jugular foramen and travels down your body, innervating all your organs, and finishes off in the gut. Okay, so the first one we're going to do is just massage, and you don't have to all do, I think I have 8 of them. Yeah, you don't have to do all 8. You can if you want. Just circle one way and circle the other way. About 30 seconds or so. Now already I'm about to take a breath. When you take a spontaneous breath like that, or if you spontaneously swallow or you yawn, you can just circle one way a few cycles and then circle the other way. That means you've had a shift. That means the vagus nerve has been connected to, and it's normalized. Now, while you're doing these exercises, I always want you to think vagus nerve, and your body will take you there. Yes, it will. That just brings you into a nice calm state. Now, this isn't really one of my 8 techniques, but it popped into my head as I was doing that. If you're someone that has a lot of tight neck muscles for whatever reason, tension, you can do some stretching. You're going to put your hand on your shoulder and tip your head one way. It's called a 50-50 stretch, which is one of the techniques we're going to do in a second, but we're just doing this a little bit more. Lift the chin up, push down, 50% this way, 50% that way. And just stretch it out until we're stretching the fascial sheets here until you feel a release. Good. Nice. Just to make sure that the neck tension has resolved somewhat so that we can really get into our vagus nerve and we're not being restricted by our neck muscles. Another one is to make sure if you have any abdominal scarring, so C-sections, hysterectomy, appendix, hernias, any of those qualify. Even gallbladder, because they tend to, if it's done laparoscopically, even though gallbladder is up here, mirror image on this side, on the right side, tucked underneath the liver, if they're doing it laparoscopically, they go into your belly button, so that there will be scar tissue even in the belly if it's just gallbladder. So sort of hold on to the belly, volumetric hold, go up, down. Which is easier, up or down? Up or down. So for me today it's up. And then go side to side, right or left. Which is easier? Keep it up, so I'm going right. Now rotate, rotate, and stay with what's easy. So for me it was up to my real right and rotate it this way. Those were all the easiest position. The ease, it's called. Now I'm just holding it. There's my spontaneous breath. Whew. Things are lightening, and now that feels so much less restricted, because I've had quite a few abdominal surgeries, so I need to do that on a regular basis. So here we go. We've got our neck all loosened up. We've got our belly loosened up. We've done our massaging our ears each way. So that's number one. Here we go. Next one. So another one we're going to do is to tone. We're going to cover your ears, and you're going to make you're going to hum. All right. So we're just going to hum. And when you finish, you can drop your head down, go side to side. You want to try to make that sound low and slow. So the lowest voice that you can get, and slow. Try to get it from deep back in the throat. Here we go again. And then we're going to do an extension as long as it doesn't bother you, and just go side to side. Yeah. All right, and you can repeat that. Hum, drop down, just rotate side to side, hum, extend as long as it doesn't bother your neck, side to side, or go to the range of motion that's comfortable for you. Okay, now, this is one I call 50-50, and we basically have done sort of that with that stretching, but you're going to go specifically on the vagus nerve. So we're going to take one hand, and you're not going to pinch, you're just going to connect. So just behind your ear where that vagus nerve exits the cranium, your other hand is going to go on your abdomen, so your intestines here, and you're going to do what's called a 50-50. So I'm not going to stretch really intensely, I'm just going to do an extension, 50% this way, 50% this way. So 50% that way, 50% that way. Now the key here is to think vagus nerve. If you think vagus nerve, your body will take you there. Now, if you don't feel this is okay. You thinking vagus nerve, your body will get you there. Okay, here we go. Here's the 50-50. That's it. Think vagus nerve. So we're pushing up with our top hand, pushing down with our bottom hand, 50% each way. You know, about 30 seconds, or until you get a yawn. There's my yawn. Or a deep breath, or a swallow. That means you've made a shift. All right, I'm just going to wait a few more seconds for those that might have not have got that right off the get-go. And I'm just watching the clock over the camera here. And there we go. Now take a few minutes, because you might be just a little bit woozy. That's okay. That's normal. Just go with it. And when we're ready, we'll do the other side. Again, we're not going to pinch. We're just going to connect to that space behind your ear, your occipital mastoid suture, specifically the jugular foramen, where the vagus nerve exits. Now we're doing a 50-50. We're going to push up, we're going to push down. Connect to the vagus nerve. Think vagus nerve. There we go. Do the 50-50, push up with the top hand, push down with the bottom hand. You're connecting to the skin and pulling it down, pushing it up with the top hand, but in your mind you're thinking vagus nerve. There's my breath. So there's the shift I made, and I'm watching the clock, giving us 30 seconds. Good. And if you need to take longer than 30 seconds, that's fine, but ideally you want to stay with this until you feel that spontaneous breath. There we go, and release. Whew. And just notice how you feel, maybe a little calmer. What I felt is the tension in my shoulders just went boom, just down. Because when the vagus nerve is activated in not a healthy way, you're going to get a lot of tension in your neck and shoulders. And your gut will feel quite tense as well. Yeah. All right, moving on. So, if you had trouble feeling that one, this one you might have a little bit easier time feeling. So you're going to put your one hand on your rib cage, and you're going to take your other hand up top of your head, and you're just going to pull like that. So the rib cage pulls this way, the head pulls this way, that way for the head and that way for the rib cage, making your body into a C. All right, so we're going to put a bit of a stretch on the vagus nerve. Now eyes look away from your hand. I'm careful not to say right, left, because this is my real right, but in the camera it looks like my left. So eyes look away from your hand. Good. Until you get that spontaneous breath, or for 30 seconds. And I forgot to watch the clock because I had my eyes turned. But I think we got about 15 seconds left. Once you get these and really can connect to the vagus nerve, your body will respond very quickly and come on out of it. And again, if that gives you grief in any way by doing the side bend in your neck, go back to the 50-50 one. All right, let's try the other side. So you're going to grab your rib cage, you're going to pull it across, you're going to take your head, tilt it away, so you're making a C on this side of the body, and then with your eyes, I'll just take a quick look at the timer, your eyes look away, and think vagus nerve. There's my breath, spontaneous breath. Good. And think vagus nerve. Keep those eyes looking over that way. I'm just going to take a peek. Good, we've got about 10 seconds left. Breathing into it, never forcing it into any pain. There's another spontaneous breath, so I might have hit another layer. Getting those different layers is always a good thing. There we go, come on out of it. And just to give a few minutes to give yourself a reset. Now, the next one, making a figure eight with your head and your eyes. So moving the eyes really helps with the normalization of the vagus nerve. Okay, and it's kind of based on EMDR. You might have heard of that technique that people use that psychologists use to help with anxiety or panic attacks or whatever. Okay, so I decided to have a figure eight drawn out because some people have a hard time figuring, what's a figure eight? Is it this way? Is it that way? But it's on a figure eight that's on its side. All right, so I'll just keep this in the camera, and I'm going to follow this with my head, but when I move my head, I'm really going to look around with my eyes. So as my head goes up to that corner, I'm going to look, and then I'm going to come down and around and look with those eyes. And you do this again until you take a spontaneous breath, or about 30 seconds. Now, while you're doing this, really look at your surroundings. Notice things. The desk, the lamp, the window, the table. Just notice things. And you can name them in your head. So if you're struggling with a bit of a panic attack right now, this might bring you out of it, because it brings you into the present while you're also normalizing the vagus nerve. So making that figure 8, moving the eyes, exaggerate that figure 8 with the head and the eyes. Look up and down and over to the other side, breathing for about 30 seconds or until you take that spontaneous breath. There you go. That's the figure 8 one. Now I'm going to have to move the camera because the next one has me lying down. So hopefully people can see this. Good. I think I'll be in the right position. Let's see. I think I have to lie. Let's see if I can get it up here because I'm going to have to move it back. There we go. All right, now I'll lose sight of the clock, but I'll take my timer here and I'll time us for 30 seconds. Where's my timer? Here it is. So you're going to lie on your back with your knees bent. I'm just going to move down a little bit. All right, where's my stopwatch? Oh, my timer. 30 seconds. So what you're going to do is you're going to hold your hands behind your head like this, and hold your hands behind your head. And basically what that does is it supports your head so that you don't turn your head. Because you're not going to turn your head, you're just going to turn your eyes. All right, just your eyes. Your nose is going to stay pointed to the ceiling or whatever you're doing this. You don't have to do this lying down. You can do this seated, but I decided to do 2 that were lying down. So this one's on your back, the next one's going to be on your belly. So here we go. Here I got the timer. Interlace the fingers, support your head. Now if you have to bring your elbows up here, that's fine. Turn your eyes to the right or the left, doesn't matter. I've got mine to the left. And I'm just holding it there. Wherever your arms are comfortable. If you're not comfortable out here, then put them wherever they're comfortable. But keep those eyes turned to the left in this case, or the right, whatever side you chose. Your head stays straight ahead. And you breathe. Now with the hair on my ooh, there's our 30 seconds. And I took a spontaneous breath right at the end. Okay. All right, here we go. The other side. Nose straight ahead, eyes turn to the right. Eyes turn to the right, nose stays pointy to the ceiling. There's my spontaneous breath. I got this side quicker. Keep turning those eyes, keeping the head straight ahead. That's it, no tension. Tension's okay, pain is not. Try to relax the shoulders, support the head so it doesn't want to move. Keep those eyes turned to the right. Breathe. I'm not sure if my timer worked this time. I'm going to double check. No, it didn't start. So that's about 30 seconds. There we go. And just notice how calm you feel. It feels amazing. Yes, it does. All right. So we're going to flip over on our bellies for the next one. Now, you're going to come into a prone position, but only as how comfortable you are. Now, some of you might be more comfortable higher up. Whatever's comfortable. I'm going to stay kind of middle of the road. And you're going to turn your head to the right. And I'm going to start it this time. I don't know what happened last time. And I'm going to turn my eyes. So I've turned my head to the right, and I've turned my eyes to the right. So this is giving that vagus nerve on the left a nice little innervation all the way down to the gut by doing this in a prone position, in a bit of a back extension. So my eyes, my head is turned to the right. I'm working the left. There we go. Okay. Let's see, how do I get this off? Cancel. Alrighty. Other side. Turn your head left. Eyes look to the left as well. Relax your shoulders. If this bothers your back, then this is not the one that you're going to do. You're going to pick one of the other ones. You don't have to do all of them. you just pick one or two or three that you really like. What are the ones, whatever ones are comfortable for you in the situation that you're in now. So if you're on an airplane, you might not be able to do this one, but you might be able to do the figure 8. So remember, your eyes were turned to the same direction the head was turned. Okay, now, last one. We're going to take something, forgot to bring the camera with me. So, this one, you're going to need some cold. Now, you can get a bag of ice or some frozen peas. And, of course, you don't want to put that bag of ice right on your skin. You might need to wrap it in a towel or something. And so this is just a cold pack, and I'm going to use the side that has material on it. So, very simply, and I'll watch the clock that's over the camera here, I'm going to do 15 seconds, tucked underneath my ear, tucked up behind my ear, and on my neck, and I'm going to hold that 15 seconds. Cold therapy is quite amazing. Yeah. Now, another one you can do is you could just go splash your face with cold water in your neck if you're in a situation that you don't have an ice pack. Okay, there's 15 seconds. I'm going to do this other side because that side wasn't that cold anymore. It's been down here for a bit with me. So tuck it up under behind your ear and down on your neck. And again, if it's too cold, you need to wrap it in a towel. And I'm just holding that for 15 seconds. And I'm going to do it twice on each side. Anyone who suffers with migraines, like I tend to, knows the benefit of cold. Switch it again. Yeah, it feels amazing. Good. So just 15 seconds on this side to again once stimulate or help normalize the vagus nerve. There we go. And last but not least, last side, tuck it up behind your ear, down your neck. There we go. There's our 15 seconds. Wonderful. And there you have it. There are 8, plus that little bit of a stretch that we did, exercises, techniques, tips that you can try to help normalize your vagus nerve. Good luck, happy healing, take care, we'll see you next time. Bye-bye.